Hi, this is Eric Roof, Chief Executive Officer of Barbour Community Health, and we're here today with several great guys. I should say that's not a couple, but a few great guys that I've had the pleasure of working with in coordinating the county vaccine clinics. And I wanted to come to you today to talk a little bit about what they are and how to participate and talk a little bit about the vaccine and so forth. So let's start first with Mr. Rich Mace, owner and pharmacist at Mace's Pharmacy. Rich, tell us what exactly is the community vaccine clinic and where is it? Tell us a little bit about the clinics.
Well, they're a whole lot of fun, Eric. You've been to every one of them. I do know that. They're usually Saturday mornings. We get started about 8 o'clock. There at Philip Barbour High School. Parking's over to the side, over where the students park. But about 8 o'clock, and we usually are there till about noon, doing a bunch of vaccinations. And actually, it's been a really good experience for us, and I'm sure the other guys here on the call can say that too. It's been a lot of fun and doing a good job.
Thank you. Thank you very much. Corey, tell us a little bit about, by the way, Corey Brandon, Director of the Barbour County Office of Emergency Management. Been a pleasure getting to know you and working with you on this project. So tell us a little bit about who all has been involved so far. I know you have been so great about reaching out to all kinds of agencies to help with these events. So tell us about that a little bit.
Well, every week we have Barbour County Health Department scheduling, which is one of the hardest chores through the week of getting all those slots filled. And on top of that, they're also present there at the vaccination clinics, along with the Barbour County Community Health Association, being both of the clinics, Mace's Pharmacy, Broadus Hospital, Barbour County Family Medicine. Let's see. We also have Board of Education there present, as we are using their facility, but they also volunteer their time to assist. We also have Barbour County EMS on scene, usually 2 crews to monitor the patients, to make sure that nobody's having adverse reactions and they're on the scene in case an incident does occur. We also have Barbour County Sheriff's Department and their deputy reserves checking people in at the door to make sure they are who they say they are. We also have Philippi PD plus their task force doing the same, and also assisting with wheelchair, door entry, anything like that. We also have community volunteers, either through our own community, or most recently we had 3 come through the West Virginia VOAD Association. So we've had a lot of assistance from our community and beyond. It's been a great help.
You're exactly right about that, Corey. It's just been impressive, and it's been really kind of, in a weird sort of way, it's been a nice community event. Just a lot of people getting to see each other and not visit too long or too much, but that's been great. Dr. Holbert, I want to turn things to you. You're representing the Barbour County Health Department today, and also proud to have you on our staff at Barbour Community Health. Tell us a little bit about the vaccine itself. Why is it important, do you think, that folks should get this vaccine, and is this community clinic a great place to do that?
Absolutely. We actually have been given the Pfizer vaccine. So it was the first one out, the first one granted emergency use authorization. It's a 2-shot series, 3 weeks apart, highly effective. In the clinical trials, 95% effective at preventing even mild symptoms, and more effective than that at preventing severe disease. We're glad we've been tasked with just having one vaccine. Some of these clinics have had to adapt and switch between Pfizer, Moderna, and even the Johnson & Johnson vaccine now. But we're just really glad to have this one, to know that we're getting it a couple weeks in advance so we can plan for it, to know that we've got an ongoing supply of second doses for people that receive their initial doses at our clinics. And this is how we're going to get back to some semblance of normal in the United States and in the world, is by getting as much of the population vaccinated as possible. I think Barbour County is currently over 30% with our vaccination efforts, which is awesome. We're slightly above the state average, which is also awesome. The state's coming along, and they're actually reshifting some of the vaccines to the counties that are maybe straggling just a little bit behind based on percent population, so that there's equity along the state. We would be prepared to give the other vaccines if we needed to, but at this time, I think it's kind of in our wheelhouse to stick with the Pfizer vaccine. We've also been able to do some outreach to take some visits to people that can't get out, whether they can't get out entirely and we're taking them to their homes, or whether they can't get out of the vehicle and we're actually meeting them in the parking lot. But largely for efficiency, we're doing all of our vaccines in Philip Barbour High School, which has worked really well for us. We've been able to put over 200 people per hour through the clinic, which I think for a county of our size is doing really good.
Very good. Thank you so much for that. Rich, I was just sitting here, clarify for me. Now, in Barbour County, we don't have that Johnson & Johnson vaccine yet, correct?
Correct. Not yet. It's been recently approved. It's a one-shot series as opposed to the Moderna and to the Pfizer, which is a two-shot series. Our Pfizer doses that we're doing, we do one, say now, and then one 21 days later to finish out the series. But the Johnson & Johnson is a very good product also. It's got a high effective rate. As I said, only one dose. It's one and done. So that's very good. And we can get a lot more people vaccinated quickly with that to get it fully vaccinated. And after 28 days, it's got a remarkable effective rate also. But none here yet, but probably will be.
Good deal. Good deal. Yeah, that's similar to what I heard on a call yesterday I was on. And I think right now the state has some doses, but they're going to target maybe the homebound folks, or maybe even some of the folks on MAT programs, or in that realm that maybe they only need to reach out to one time and might make things a little easier. Rich, you've been involved in a lot of vaccinations in Barbour County. Just real quickly, tell us a little bit about all of the different entities and groups you've been involved with.
Well, back in December, we got a call on a Sunday night right after the Pfizer dose was approved and said, hey, we need to vaccinate the long-term care facilities. Can you help us? Krista Capehart, Morgantown, she's got a long credential list of all the things that she does, but she's been instrumental in getting independent pharmacies and all pharmacies involved with getting out in the community and doing vaccinations. So we started with several long-term care facilities, and West Virginia was the first to get long-term care facilities fully vaccinated, or anybody who wanted vaccinations in those long-term care facilities. So that's something to be proud of. I mean, West Virginia in general is leading the pack here, but I was proud to be part of that and getting things started at several nursing homes, and just we had some community clinics within our pharmacy also. So just happy to be involved with that. And then of course our community clinic now, wow. I mean, for a small community, we have done a remarkable job with all the parties that are involved. It's amazing how it's come together and how efficient that we've been, and we should be proud that Barbour County is, I think, is leading the pack.
Very good, very good. Corey, back to you. What's been maybe most impressive to you about the different agencies that have stepped up to really help with these vaccine clinics?
Honestly, the greatest thing is how easily everybody works together. We knew that this was going to take the community to pull together to accomplish something like this. And it's a whole lot easier if we have a great working relationship. And it didn't take any struggle at all to get all the key players talking early on, planning early on, and that goes leaps and bounds when you actually put operations into play, of having that plan ahead of time and having the support in our community where we're not have to struggle to find people to help with that situation.
I agree with you 100%. I think the other guys would too. So All right, let's get down to the details. So if I'm sitting at home watching this video, Dr. Holbert, tell us, how do I get on the list? How do I get registered? How do I get out to Philip Barbour High School? When should I come? Tell us some of the details about how that happens.
Anybody struggling can always call either of the clinics in the county, the Myers Clinic at 457-2800 or the Billington Clinic at 823-2800, or the Barbour County Health Department at 457-1670. The state prefers that everyone use the state website. We call it Everbridge because that's the name of the agency that's setting it up. And there's a website, vaccinate.wv.gov, G-O-V, or 1-833-734-0965. And although I should have that number memorized because I've given it out so many times, I had to glance over to see what it was just to be sure. That's a statewide effort. And if you sign up there, you can list your age. You can list if you're an essential employee, if you're related to schools, if you have high-risk conditions, which have recently been added to the list of things that can get you a shot. The state will then make those names available to the counties, and we're able to pull those lists down. You could also potentially receive a call from a local Walgreens. They're doing some direct from the federal government vaccination efforts now. And I know of some patients that maybe don't meet our current criteria because we're still working down through the age groups that have gotten called by Walgreens to come get their vaccine.
Very good, very good. So get to the website or call one of those numbers and get yourself registered. That's really important. And Rich, the age groups are that we're targeting right now.
50 plus right now, or basically anyone who has one of those health conditions will qualify.
Very good. Are there side effects to the vaccine, first or second dose, or both? Rich?
Side effects, yeah. So you can kind of expect flu symptoms and everything from a headache, fever, the aches and pains that come along with the flu. But having said that, that's the kind of reaction that you want to have. You want to have an immune response to the vaccine so that you know it's working. So there's a couple different ways to look at it, and is it a good thing or a bad thing as far as side effects go? But you want to have those symptoms present so that the vaccine's working for you. So and I know Dr. Holbert and I we discussed taking ibuprofen or acetaminophen or something like that before the shot, and we'd kind of like to see people get that response before they start taking ibuprofen or acetaminophen. But yeah, there are some side effects, but they're quick and they're gone quick. It's definitely worth it for the protection.
Yeah, and I can give a testament to that. I had my second vaccine on Saturday morning, and today is Tuesday. And on Saturday night, Sunday, I ran a little bit of a fever. It wasn't anything unmanageable, but and here I am. I'm still okay. I'm back to work today. Corey, now if I understand right, and from a community perspective, is it accurate? We still need to wear masks and socially distance and wash our hands and all that. Is that your understanding?
Absolutely. That is still encouraged. I'm fully vaccinated. I still wear my mask in public. I still wash my hands. Also, I don't understand why washing hands was ever an issue, but that's the world we live in. And but even if you're fully vaccinated, you could still potentially carry it without having the symptoms. So to protect others in the community, others in your household, or visiting anybody at all, if you can't social distance, absolutely, you should try to get your mask on.
Very good. Thanks, Corey. Dr. Holbert, do we know yet how long the vaccines last or will be effective once we get them and they're in our bodies? Do we know?
Well, it continues to evolve as more real world data comes back in. They continue to push the date out. Just yesterday, the CDC did release some additional easing of restrictions for fully vaccinated individuals. So anyone that's 2 weeks post their second dose of either Pfizer or Moderna or 2 weeks after their initial dose or only dose of Johnson & Johnson. Fully vaccinated people, and I'm going to read this directly off the CDC's website, can visit with other fully vaccinated people indoors without wearing masks or physical distancing, can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing, and can refrain from quarantine or testing following a known exposure as long as they remain asymptomatic. So that's hot off the press, just released yesterday. You'll probably see it all over the news today. I think it is very important to point out, though, what Corey says. These are very limited guidelines to relax those restrictions. So if you're going shopping, if you're out in public, if you're around people you don't know their vaccine status, or it's not a single family household, you should continue to do all the social distancing, mask wearing. And obviously, we should all continue to wash our hands. That's probably going to go without saying for the next 2,000 years.
That's true. That's what my mama taught me. So always important. All right. Well, let's kind of wrap things up. It's always a pleasure to chat with you guys, and it's been a pleasure working with you. So I'm going to ask each of you kind of one final question, and it's very open and broad. If there's one really important thing we've talked about this morning, Rich, what's the most important thing that you want our community to know about the vaccine and the vaccine clinics and the work that we're doing?
I'll tell you something that just popped into my head is let's get as many people vaccinated as possible so that we can get what's called that herd immunity, and we can get life back to somewhat a semblance of normalcy that we've known before. I just think, again, what's amazing with our clinics and how they've just gone so well. We just need to get more people in there and get more people vaccinated, and hopefully we can get more vaccine and again get that herd immunity.
Very good. Thank you. Corey, same question for you. What's the most important thing you want our community to know of the information we've talked about today?
I think the most important thing that we've seen so far, at least in our community and doing research, is that this is a safe and effective way to prevent hospitalization due to COVID. It's a painless, for the most part, those that participate in getting a vaccination, but on the end result of it, it's the fact that the reduction in hospitalization due to COVID has greatly decreased because of this.
And Cecil, same question for you. What do you really want our community to know based on our conversation this morning?
Well, I'll kind of throw two things in. One, just to reinforce Corey's, that these in general are the safest, most effective vaccines we've ever had. If we had a flu shot that was as safe and as effective as this, we would be jumping up and down. So I highly encourage anyone that's sitting on the fence, maybe waiting to see what happens to everybody else. There have been tens of millions of United States residents vaccinated, hundreds of millions of people worldwide. These are safe and effective vaccines. And then finally, just to reassure the population, the limiting factor in us getting everybody in Barbour County vaccinated is vaccine availability. So please bear with us, because we're getting these out as quickly as we're receiving them. And the more we get, the more we're going to reach down through the lists, layers. And we are following the state guidelines. Some people seem to be out of their tier, because when we have vaccine and it's about to expire, we're going to give it to whoever's next on the list. But if you're especially over 80, reach out to the health department, because there is no reason you can't get a shot this weekend. And then ongoing, coming down through those age groups, if you feel like we're moving into the 50s and you're over 65, call one of the clinics, call the health department, or call one of Mesa's pharmacies. We will get you this shot. The more we get, the quicker we'll do it. And we're just glad to be getting Barbour County vaccinated.
Good. Thank you guys very much. It's been a pleasure chatting with you this morning. And once a week, at least we're talking, if not 2 or 3 times a week, just as we plan for these vaccination clinics. So, all right. Thank you all for joining us on this video this morning. Hope it's been useful for you and helpful. And on behalf of Barbour Community Health Association, Eric Roof, your CEO. My final thought is there's no reason to wait. You must vaccinate. There you go. I'm out. Bye-bye.